So my name's Jenna. I'm 29, almost 30, a couple of months. I was diagnosed with relapsing remitting MS in December 2017.
Can you talk about when you actually started treatment with Mavenclad and what made you choose that particular DMD?
Yeah, so originally, after my diagnosis, I started Cladribine in February 2018. So that was about 3 months after I was diagnosed, and I was on that for um, three, almost 3 years. But I had a baby just at the end of August last year and had a relapse about 4 months after that. And that's when they said to me to try some stronger treatment. So they gave me 5 options. I kind of narrowed it down to either the Mavenclad or Ocrevus. But I've decided on the Mavenclad just because it was a little bit less invasive than an infusion. So that was kind of one of the main points for me on that.
And were there any tests that you had to have beforehand just to make sure that you would be able to have that treatment?
They have it. So they tested the white blood cell count. So there's some blood tests, urine tests to make sure that you weren't pregnant, because it is a medication that you can't get pregnant on. So that was a bit of a change with when I started Cladribine. The advice was to stop at 3 months before you started trying. And then that advice changed to say it's okay to take it while you're pregnant, while you're trying to get pregnant, and again, okay to take it through your pregnancy. So then going on to Mavenclad, sort of saying definitely don't do this until you've kind of finished your complete sort of course of treatment. And there was also a chest X-ray before I started the Mavenclad as well.
And can you talk a bit about how you take Mavenclad? Because I know it's a little bit different to some of the other treatments. It's not like something you take it's an odd sort of treatment plan. So
yes, it is, because it's not a regular treatment.
Yeah.
So with Cladribine, that was an self-injection every 2 weeks. Not nice injecting yourself, but something that you do sort of get used to. And then with the Mavenclad, it was tablets. So it's based, how many tablets you take is based on your body weight. So for me, I had 6 tablets per week, and it's basically 6 tablets that I took for 1 week in April, 6 for 1 week in May, and then you don't do anything for a year, and then you repeat the course, and then that, hopefully, fingers crossed, if it works, should be me for maybe 4 years. I think is roughly kind of what most people get out of Mavenclad.
Mm-hmm. And how have you found that it's fitted in with your lifestyle? Has it been quite a convenient treatment for you?
It is quite a convenient treatment. Yeah, it's nice to just sort of do the course of tablets and then not have to worry, not have to remember sort of taking anything else. Also kind of felt it was better than the infusions because it gets delivered to your home. You can take it home. You don't have to travel to hospital to take it. Whereas with some of the other DMDs, if you have to go into hospital, it's trying to get time off work, because this was probably one of the bigger points when I was choosing something as well. Can I afford to take time off work? Because although your employer legally needs to give you time off, they don't need to pay you for it. So it's, can you afford unpaid time off? Do you take it as annual leave? I'm now working 4 days a week after I had my baby. But I don't really want to go into hospital on the day that I'm meant to be spending with him either. So yeah, that was probably one of the bigger points to it as well.
Yeah, I suppose it can be quite time consuming if you do have to go into the hospital for an infusion, which is not a quick thing at all. So yeah, having something you can take at home is a lot more practical.
Yep.
And since you've been on it, have you had to have any sort of monitoring in terms of blood tests? I know some drugs you have to have quite regular monitoring. I wasn't sure if this was something that you have to do with Mavenclad too.
Probably regular blood tests. Actually had a call with my MS nurse this morning who just arranged some more blood tests for me. So this will be my first set of bloods getting done in the next few weeks since my course. So fingers crossed everything is on track and I can keep continuing on the medication. It is quite hard when you're you sort of get used to something to be told it's not working anymore, and having to change it. I know it's quite a hard thing to make a decision on, because of all the medications all have their different side effects. And
it's about how it fits in with your lifestyle, and then also weighing up all the sort of risks and benefits of the drugs as well. So it is a big thing if you do have to change. In terms of side effects, have you noticed any side effects from Mavenclad, or were there any that you were worried about getting that maybe that you haven't ended up experiencing?
I've been quite lucky that I haven't noticed any side effects. The one that I was most worried about was hair loss, but because I had postpartum hair loss anyway, if Mavenclad's had any hair loss side effects, I've not noticed it, to be honest. So yeah, that was the sort of main one. I was kind of having visions that my hair was going to be coming out in clumps. Thankfully it hasn't.
Oh, that's good. And the other thing I wanted to touch on was sort of, obviously we've got the coronavirus pandemic still going on at the moment. So Mavenclad obviously can increase your risk of infection. So if you had to sort of take any extra precautions in your lifestyle since you've started on the treatment, has it affected you much at all?
So one of my questions before I started the treatment was, do I need to shield? Because I think following the sort of MS Trust and things on social media, some people have been told that before starting it they did need to shield. I was told that I didn't. So I don't know if it depends on people's white blood cell count and where the rates are of coronavirus in their area, because I was told that if the rates went very high again, then they might revisit the advice that they'd given me and potentially would need to shield. But I think I just sort of have it in the back of my head that I need to be a little bit more careful, and I might get ill a little bit more, I might catch colds and flus when everybody kind of starts interacting again. But fingers crossed, I have been okay so far. So
that's good. And my final question was, what would you say to other people that are perhaps considering going on this DMD?
I think definitely when choosing a DMD, I'd definitely make use of all the sort of materials out there and do research to make sure it fits in with your lifestyle. I don't think I would have chosen Mavenclad if I was considering having a child, but given that I had already had one, it's fine for me. I can sort of take that break. But I think just sort of doing your research and making sure that it is going to fit into your lifestyle, just because there is so many different options for people.